Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of our flagship stations, 89.3 Lakes FM and Civic Center TV. In addition, today we're on Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the Village of Franklin. Both our TV stations, Comcast, Channel 15, and AT&T, Channel 99. We're also on the radio in Bloomfield Hills on 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District, as they celebrate for the 10th consecutive year High School Radio Week. Congratulations to them, a founding station of High School Radio Week over there. In addition, today on the web, civiccentertv.com. Click on our Watch Live link or on the small player there on our homepage at the top right. And on Facebook, Civic Center TV 15 and Lakes FM. And as always, joining me from her home studio in Keego Harbor is Ronnie Dahl.
Happy Friday.
Yes, happy Friday to you as well, Ronnie.
So I have to say, the good thing, the sun is shining, the snow has melted, and today is the second birthday for our rescue dog, Trixie. So I went to send a tweet this morning, not about Trixie, but our dog has a Twitter page. And it started with our other dog who had passed away. But my husband put it on my phone, and sometimes for some reason it just switches over from my Twitter page to the dog's Twitter page. And I don't know, have you ever had to manage more than one Twitter page on your phone?
I have before. I have had to manage multiple Twitter pages on my phone. Usually during the football season, I'll add Civic Center TV and or Lakes FM's Twitter pages to my phone just so I can do some tweeting during the football games, especially the bigger ones. And then, of course, I got my own personal one as well. So there's been other cases as well when I was in college working on the Beaumont Bulletin over at Michigan State that we had a similar situation. But I don't know if you're able, you just got to really focus and look and see which page am I currently looking at. And sometimes I can tell by the main page and who I'm seeing in the main feed, but you just got to focus on it and know which page you're on. It can be a little difficult sometimes when you're juggling all those pages and all that information, especially when you have a lot of similar followers.
So I wonder too, like, well, Trixie, or it's under Eight-Legged Trio because that's our family name, which was started with our other dog, Katie. She only has like, I don't know, 100 followers. I don't know. So if I can't tell the difference, yeah. I think I might have 5,000. So, but I did notice before, sometimes my husband will go onto her page and tweet stuff that he doesn't want people to know that's associated with him. Okay. And usually political stuff. And I'm like, you really think people can't figure that out? I mean, come on.
Does he think that they think the dog is tweeting this out? That Trixie's just sitting at the computer, puts on her glasses, and is typing with her paws these opinions? Come on.
Right. But you have heard, there have been nightmare stories, so where people have managed business pages and they tweeted out things thinking that it was going across their personal pages. So always just a warning. So poor Trixie, she's got some crazy stuff on her Eight-Legged Twitter page. But again, happy birthday to her. I took her out this morning, of course, for her birthday. She loves to get puppuccinos.
Of course.
I'm trying not to say, I don't want to say the word too loud because
no, yeah. Oh yeah.
And Starbucks, I knew they were closed on the weekends. They don't open until 9:30, but during the week as well. That's how hard it is to get employees right now for so many of these companies and these businesses. And you're wondering, isn't the morning the busiest time for Starbucks?
You would think so. I mean, it just goes to show how tough it is for these businesses, whether it be national chains or local mom and pop shops, to get employees. I mean, we've heard it across a number of industries and even to some extent businesses that have been having a pretty good year who have said we've had to close one or multiple locations. Even earlier this week, we talked to Toyology Toys, who had said they had to close one of their locations simply because they couldn't staff that location properly. Not because business wasn't good, but because they simply could not put enough people in there to manage the stores properly.
It's just crazy to me.
It is.
Hey, we have a jam-packed show on this Friday. See, most people skate on Fridays.
No.
I remember way back in the day when I was a producer, I used to produce the 11 o'clock news eons ago, right? Like back in the beginning of my news career, we would call it 5 Package Fridays. So we would just load the show with packages so we could skate on Fridays, but we're not skating today. We have a jam-packed show for you. So with that, we're going to jump into the headlines because we want to get to all of our guests. But I will say today is really a big day for Johnson & Johnson. As we all know, the vaccine had been paused, but some health experts are saying, yeah, it was really a good idea for them to go ahead and pause the vaccine. However, they're saying now is the time to allow the shots to get back on the market. So a number of experts said they expect a government advisory committee, which is meeting today for the second time in less than 2 weeks, to lift the hold on the shot. And depending on what it learns about the mysterious blood clotting ailment, the committee might add an age restriction or simply a warning label to the vaccine. So the Centers for Disease Control and Prevention has reported 8 cases out of more than 7 million vaccine recipients of an ultra rare combination of blood clots. We've been telling you about this. So typically a health effect is determined to be caused by a vaccine if it occurs at a higher rate in the vaccinated population than among the unvaccinated. So the CDC committee, called the Advisory Committee on Immunization Practices, or ACIP, it's going to recommend that the agency add a warning label to the vaccine about this very rare side effect, or it can recommend a limit in its distribution to a certain group of people. Any recommendation from the committee, though, has to be approved by the CDC as well as the FDA. Vaccine experts doubt that the committee is going to recommend shelving the vaccine altogether because the side effect is so rare. And we do know in Europe, they have already given the green light for the Johnson & Johnson vaccine to go forward.
Yeah, we were kind of expecting this to happen this week, for there to be a short but thorough investigation into these rare blood clots and the other symptoms that had been discovered and warned about in previous weeks regarding the Johnson & Johnson vaccine, but then for it to come back to the market. How that's going to happen, they're still going to determine. I would guess they just put a warning label on the vaccine, warn each person that's going to get vaccinated that there is a small chance, but a chance that this could happen, and then provide information to primary care providers so that should their patients end up with these ailments, with these symptoms even, that they know what to do.
I will say I was scheduled to get the J&J vaccine the day the pause came down. So it kind of makes you go, okay. But, you know, so many people are thinking about that right now. Yeah. Hey, by the way, though, we do know that more and more people are a little bit hesitant to get the vaccine right now, Tyler. So in the beginning, there was such a rush on trying to get the vaccine. Now it's slowing down. However, Michigan is going to continue to receive additional federal resources to try to boost the vaccine. So more than 200 federal personnel is going to be arriving in Michigan this week to assist at 3 mass vaccination sites. That's according to the governor's office. Federal personnel, it's going to be a group comprised of members of the Department of Defense, U.S. Coast Guard, and the U.S. Forest Service. They will be assigned to DeVos Place in Grand Rapids, along with Ford Field and TCF here in Detroit, to help with the COVID-19 vaccination efforts. So personnel is going to serve both clinical and non-clinical roles at the vaccination sites. Personnel began arriving this week. They're expected to be fully operational no later than the 28th of April. Michigan recently reached a milestone of 6 million doses of vaccines distributed in just over 4 months, with the most recent 1 million vaccines administered in a record of 11 days. So to date, 47% of Michiganders have received at least 1 dose. 33% of Michiganders are considered fully vaccinated right now. And we are seeing more and more times, including at the TCF Center, that they're now starting to offer walk-ups. So you don't have to have an appointment because they have more supply than demand. So they're trying to make it easier for people to get vaccinated right now.
Yeah, we've seen one of the common issues throughout the vaccine process so far is getting people to be able to sign up for those vaccine appointments, make those vaccine appointments, and come back as needed along the way. So having these walk-in appointments be available, not only does it give people more convenience to go and get their vaccine at their own convenience and a time that works for them, and not having to, but they also don't have to navigate if they don't have internet access or have trouble with technology, having to go and sign up mostly through internet means or figuring out who to call and what information is needed in order to sign up. They can just go, and that will certainly help, hopefully speed up the vaccination process here in Michigan, where, as it says in this article, about 33% fully vaccinated, 47% with at least one shot. With that, we're just a little under halfway to that low end of where we need to be at about 70 to 80% for herd immunity here in Michigan.
So the Michigan Liquor Control Commission softens approach to COVID-19 rule violators. As we all know, there were a handful of restaurants that ignored the rules this winter when Michigan closed indoor dining, while local law enforcement and some state agencies hesitated to step in. The Michigan Liquor Control Commission was perhaps the biggest enforcer, suspending liquor licenses at 36 businesses here in the state of Michigan. So with the dine-in ban over, the MLCC has softened its approach and hasn't suspended a liquor license in nearly 2 months. It's transitioned to issuing written warning tickets instead of emergency suspensions in most cases. That's according to the spokesperson for the MLCC. So there's no penalty to a liquor license for a written warning ticket. However, it does become a part of the licensee's permanent violation history. So if they get more violations, it could play into a determination if they need to lose their license a little bit later on. The MLCC does not have an estimate as to how many written warning tickets it's handed out since March. It isn't publicizing which businesses are ticketed. That's according to the spokesperson, and they declined to comment on the reason for the new approach. So while Michigan does allow for indoor dining again, there are still COVID-19 rules in place. Capacity is limited at 50%. There's an 11 p.m. curfew. Masks must be worn at all times when people are not eating or drinking. The health order expires May 24th. It's expected, though, it is going to be extended. So, of course, you can find all the latest headlines if you just go to civiccentertv.com, click on coronavirus. There you'll find the latest headlines, and also at the top of the page, we have tried to make it a little bit easier for you by putting direct links to some of the resources for you to be able to read some of the changes here around COVID-19 in the state of Michigan for yourself. That includes the CDC, the state of Michigan, as well as Oakland County. So just trying to help you be informed here as we continue to navigate the COVID-19 crisis. We're going to take a quick break here on the Megacast. And when I said we're going to jump into the show a little bit early, and when we come back, tomorrow is the DEA's National Take Back Day. How is it going to look a little bit different this year in the middle of the pandemic? But also we have so many people, our kids and our students that are at home now more than ever, why it's so important for you to be able to have a safe place to get rid of some of these medications sitting around your home. That's next, right here after the break on the Megacast.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
To you. I'm Ronnie Dahl here in my home studios. While Mr. Tyler Keefe holds things down for us back there in West Bloomfield, we want to say thank you to all of you for joining us here on the Megacast. As many of you know, the show actually started out of the beginning of the pandemic. Tyler and Dave Scott came up as a way to try to keep our community informed about COVID-19 because things were changing at such a rapid pace. They thought the show would last 2 weeks, maybe a month. And here we are more than a year into the pandemic. The show is still going on as we all continue to navigate the COVID-19 crisis. And one thing we have seen throughout this pandemic is the growing concern about, so many of us, we have our kids. They're in our homes, they remote learning, and especially for the high school students, a lot of them are unsupervised. And there is a big concern that this could lead to an increase of addiction because they've been able to get their hands on some prescription drugs that are left in our homes. The DEA, though, for years outside of the pandemic, they've had a national campaign called the DEA National Take Back. So to talk a little bit more about that, we're lucky to have Brian McNeal with us here on the Megacast. He's the Public Information Officer for the Bureau, or for the Department of Drug Enforcement Administration. A lot of people think DEA is Drug Enforcement Agency. It's Drug Enforcement Administration for the Detroit Field Division. Brian, thank you again for being with us. I know we called you last minute.
No, thanks for having me. It's my pleasure.
You know, I'm so happy to have you with us because so many people, this is springtime. And what do we do in the springtime, especially in the middle of the pandemic? We're all cleaning and organizing our homes, and that includes cleaning out our cabinets. For so many people, the first thing they think when they come across old drugs is either one, they'll leave them, or two, they flush them down the drain or the toilet. They don't want to do that.
No, absolutely not. Our municipal water supply partners have said that's bad for the environment. It can leak into the environment. So that's one of the reasons we started this Take Back Day, is to give people a safe way of disposing of those medications, not just for our environment, but to protect our loved ones.
So from the DEA side point, this really takes a big effort for all the local law enforcement agencies to buy into this as well.
It does. I'm proud to say the Detroit Field Division has over 500 partners, whether it's law enforcement or community organizations, to man these Take Back Day drop-off boxes starting tomorrow at 10 a.m. And it is a huge undertaking. We're so grateful for everyone who's pitched in to do this wide-reaching community project.
It really is. And I will say for so many of us here, and like locally, I live in Kegel Harbor, Brian, we have a very small department. I know Sylvan Lake is very small, Orchard Lake. And so their office is closed. And we went to take some of our dog's medicine. And we're like, oh, wait, you have to have an appointment to get in. So this is a good opportunity for people to clean out the cabinet, because I know so many of these departments are going to be open for you to drop off any medication. They don't care what it is.
Yeah, we partner with all of our law enforcement partners to man Take Back Day twice a year, once in April and once in October. But you can actually go do a web browser search and type in DEA Take Back, and it'll show you where you can take back these medications all year round. And most of the time they're at a local police station. But we're really grateful for our partners for manning these things for us on our Take Back Days.
So what happens to the drugs after they're collected?
Well, we collect them and weigh them so we know, so we can track. That data is very valuable. And then it gives me some bragging points to my partners in Louisville and Chicago. But then we dispose of them. We take them to an incinerator, an incineration facility. It's not, a fire out back, and we burn those.
With us right now, Brian McNeal. He's the Public Information Officer for DEA's Detroit Field Division, and they have tomorrow their National Take Back Day. If you are cleaning out your medicine cabinet, this is how you want to properly dispose of those unused medications. And Brian, I'm wondering, are you guys seeing any trends, or it could be too soon to really tell right now, but because of the pandemic, we have so many kids that are at home alone in their homes, and more teenagers, right, than ever before. So do you anticipate that there could be an increase in addiction because they've been able to get their hands on some of these drugs?
Like you said, it's still early in the process to analyze that data. The data we have been able to see, it's not necessarily at the youth population, but from September 2019 to September 2020. Some of that predates the COVID restrictions, but we saw an increase of overdose deaths in the 80,000s. And that's a disturbing trend. And we know a lot of time addiction begins with that home medicine cabinet. There are very few people who wake up one day and say, today's the day I'm going to do heroin. It starts with prescription pills, and then it slowly decreases or degrades to heroin addiction. So that's why Take Back Day is so important, is to head off those addiction issues and those misuse issues early on by removing the supply.
So with that, how many pills do you typically collect, DEA, annually on a day like this?
Oh man, I know locally we did over 80,000 pounds. I know every year we've increased our collection. You would think, when this first started, the conventional wisdom was we would eventually plateau, that we've cleared out all the inventory and that it's going to go down one day. It has not happened. Every year we collect more than the previous year. This is our 20th take back. We weren't able to do take back last April because of the pandemic, so we just encouraged people to hold on to their drugs. And in October, we saw an explosion with what we were able to get off the streets. And it just goes to show how much is still out there and how much we're really getting that awareness out there.
And that really is a big part of it. It's the campaign. It has grown over the years because a lot of people are confused. What do they do with the medicine that's left over if they don't take all of it? And another important factor in this is for people who do have some of these drugs in their homes, make sure you're counting your pills.
Absolutely. One of the things that we have done on the other side of the issue is working with our healthcare providers and right-sizing the prescription. Maybe 20, 30 years ago, you would have maybe a knee surgery or some dental work, and you would get 30 pills and use 10. And then where are those other 20 going? And nowadays we're working with our providers saying perhaps it's 7. Maybe we start with 7 or 10, and then working afterwards. If you're still in pain, let's give you some more. But it is really important to not just right size those prescriptions, but what about storing them? Is the medicine cabinet the best spot for those pills? Maybe there's a lock safe that we can store those in. All the time we have friends and family in our house. When do they have privacy in our house? It's when they're in the bathroom. And if someone has a misuse or an abuse problem, it's no effort to just open up that medicine cabinet, see what's there, and take the whole bottle, or like you said, 6 or 7. You're not going to notice usually 6 or 7 if you have 30. But if you have 7 and someone takes 6, you're going to know.
We're talking with Brian McNeal. He's a public information officer for the DEA's Detroit Field Division. And Brian, just kind of reading from your website, 9.7 million people misuse prescription pain relievers. 4.9 million people misuse prescription stimulants, and 5.9 million people misuse prescription tranquilizers and sedatives. That was just in 2009. The number is alarming. And, we have so many efforts being made, right, around people locking up their firearms, keeping their firearms secure. The same needs to be said about our prescriptions as well. especially our elderly, because you'll have grandkids that maybe visit their grandparents.
Yes, all too often, you mentioned the elderly, all too often we hear stories throughout the year of when, unfortunately, an elderly relative has passed and the family is there to clean out the house, and they've got this massive amount of prescription pills and they don't know what to do with them. And if those pills aren't locked up, it's an easy way for a young person, a grandkid, to get a hold of those pills. And it's an accidental poisoning.
And with that, they end tragically as well. So Brian McNeal with us here on the Megacast. And with that, Brian, I know that the D.E.A, you guys do so many other things as well. Any other programs you want to touch on today?
Sure. One of the things that we really are making Southeastern Michigan population aware of is the rise in methamphetamines. You know, when the show Breaking Bad was popular, it depicted methamphetamines as something that's being cooked in a Winnebago or in a lab in someone's house. But as that show progressed, it showed these super labs that are being built in Mexico. And that's what's happening is these super labs are producing high-grade meth. Back in the 80s, 90s, 20% was you've got some good stuff. We're seeing these labs produce upwards of 95% purity in methamphetamines, and they are simply flooding the market. And they are almost giving it away to create a demand for methamphetamines. So in Southeastern Michigan, we are seeing a rise in methamphetamines. And that's something we want to make people aware of, that drug is not going away. We are focusing on the opioid epidemic, which remains the biggest threat. But methamphetamine is a rising threat in Southeastern Michigan.
See, that's one of the things I find surprising, because I do remember when we're talking years ago, Brian, I worked in Lansing. I did a special report about meth because it was more prevalent in some of the further out farm area countries, because they were stealing some of the ingredients from the farms. But it never seemed to, at that time, reach the inner city. So it's a switch now. And can you talk about how dangerous these meth places are when your agents have to raid them?
The chemicals that are used to create methamphetamines we're talking some dangerous stuff. And those chemicals are flammable. The fumes that they create are toxic. So the one-pot meth shops are really dangerous. However, we're seeing those really decrease in the rural parts of the state. And that methamphetamine is now coming from the south, and we're finding it even up in the Upper Peninsula. So meth is definitely an increasing threat.
It just is so surprising to me. And I will say, for anyone, because we do know, if I remember, again, it's been years since I've done this report, a lot of moms were getting on it because it gave them energy and also helped them lose weight. And yes. So it was more attractive to females and moms.
I could see that logic, but here's the downside, though. If you've seen the pictures, meth abuse is an ugly drug on the body. The sores, the dry mouth because you're no longer producing saliva, so the teeth start falling out. The sensation that something's crawling on you, so you start picking at your skin. The weight loss, as you mentioned, the meth can wreak havoc on the body in ways that other drugs, certainly everything, all illicit drugs can kill you. But the physical and outward effects of methamphetamine seem to be more prevalent than some of the other drugs.
And for anyone out there that is listening or watching right now, if you just Google meth mouth, you'll see like these just tragic transformations of people that have been addicted to meth and what it can do to your body as well. We're talking about Brian McNeal. He's the Public Information Officer for the D.E.A. here in the Detroit Field Division. I know you guys cover Ohio as well. Other than meth, are you still seeing the increase in the opioid crisis, or is that starting to wane a little bit?
What we're seeing now, it's still synthetic opioids, the fentanyl and then the fentanyl analogs. Fentanyl is super cheap, and it is being mixed with just about everything. We're seeing fentanyl and meth, fentanyl and cocaine, fentanyl in pill form. And a lot of times, the dealer doesn't even know that he or she is selling fentanyl. You know, they may think that it's an oxycodone pill and it's laced with fentanyl. With the pandemic, we know that fentanyl is being used as an adulterant, perhaps to make a supply of a drug go longer. But fentanyl is super cheap. And if you think about how potent it is, if you think about a grain of salt, you know, go get a grain of salt from your salt shaker. That amount of fentanyl can be a lethal dose. It is a very powerful drug. It has legitimate purposes, and it must be given by a professional healthcare provider, because these super labs or these dealers who are just mixing it using a blender and pressing it in the pill form, you don't know what you're getting.
It really is scary. So, Brian, you've been with DEA for what, probably 3 or 4 years now?
Yeah, coming up on that.
What's your experience been like as someone coming from outside the agency? What have you been most surprised about?
I've been surprised about Michigan. The Detroit Field Division covers both Michigan and Ohio. And I've been surprised about how the shift, the Detroit Field Division is based in Detroit, but Michigan's population density is different than Ohio's. And Ohio has a lot of mid-sized cities where you have your Daytons, your Cincinnatis, your Columbuses, and the issues there, although it's the same drugs, they're just different than the issues in Michigan, which is densely populated in the Southeast, but then in other parts of the state, the issues are different. So just how each region has its own individual drug issues.
And we should mention throughout this entire pandemic, your agents haven't stopped. Your team hasn't stopped. They're still working 24 hours a day, 7 days a week.
Yes, they are still out there on the street. I've had the fortune to go with them on some of their enforcement actions, and you just have to be COVID safe. You have to put those masks on, and you still have to go into these homes, into these businesses, into these locations, and you just have to execute in a different manner. But we have not stopped.
And on top of that, we know your undercover agents are still working as well. Really, hats off to so many of them, because while the world has paused for COVID-19, law enforcement has not, and that includes DEA and so many of your agents, because, a lot of healthcare professionals expect an explosion of addiction coming out of this pandemic. And so you guys are going to have your hands full. Before we say goodbye, anything else that's going on here that you want to touch on?
No, I just want to reiterate that D.E.A. Take Back Day is tomorrow from 10 o'clock to 2 o'clock. You can just go into your web browser, put in your address or zip code, and it'll let you know where you can bring your prescription medications. And it'll also let you know where you can bring them in all throughout the year. Lock them up, keep them safe, and then dispose of them as you see fit. But thank you very much for having me.
So again, it's takebackday.dea.gov. Brian McNeal, Public Information Officer for the U.S. Drug Enforcement Administration here in the Detroit area, and you cover Ohio as well. Quickly, before we say goodbye, recruiting, are you guys recruiting?
Absolutely. I know that the COVID restrictions have had an impact on that, but anyone who is interested in becoming an agent or intelligence analyst, they can certainly go to our website, and our email address for our recruiter as well as our intern coordinator are on. You can just do a Google search for DEA Detroit, and that information is there.
Because we should point out, you're lucky enough that you don't have to handle recruiting.
Yes.
When I was ATF, I had to do recruiting, which was really 90% of the job. So you don't have to do that, but we need people to join these agencies that are committed and determined to helping our communities be better, because we are going to need them coming up. And also, when you're looking at these agencies, you don't always have to be an agent. There are so many civilian jobs, such as yours, that are available and open to the public as well.
Yes, I know intelligence analyst is always, not just here in Detroit, but throughout the field division. That's probably the one that I see the most, and that's not a law enforcement position. It's critical to be able to analyze this data and to follow trends and to help with these cases.
Well, Brian McNeal, we so appreciate your time today. And again, our apologies. Number one, we got to you a little bit late, but we also kept you on longer than anticipated. So we appreciate it. And please give our best wishes to everyone over there in your field division as well, because we know you guys are working hard 24/7, even in the middle of the pandemic.
Thank you very much for having me. I've really enjoyed it.
Thank you. So again, D.E.A. National Take Back Day is tomorrow. Please go through your cabinets. If you have any outdated medicine, that includes for your pets, because a lot of them are very strong narcotics just as well as they are for humans. Please clear them out and dispose of them properly. We're going to take a quick break here on the MegaCast. Still a lot to get to here on the Friday edition of the show. And when we come back, we'll be heading over to the Rochester Hills Public Library. This is the MegaCast.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline, and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine. COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Great to have you with us here on the Friday edition of the MegaCast. I'm Ronnie Dahl here in my home office while Mr. Tyler Keefe holds things down back there at the studio. As a reminder, we are always here Monday through Friday, 10 a.m. until noon live. And then you can catch the rebroadcast on our website, civiccentertv.com. We also do like to air the show on Birmingham Municipal Access. And if you have cable, thank you. Channel 15 on Comcast is where you'll find us, 99 on AT&T. And to make things easy, you can listen to us on the radio. If you have to go out and run a few errands, tune us in, 89.3 Lakes FM, 88.1 FM The Biff. And then today we are also live streaming today's edition of the MegaCast on our Facebook pages, Civic Center TV and 89.3 Lakes FM. For so many of us, the library has been a sanctuary prior to the pandemic. It's a great place to escape. But they've had to change their ways, like so many of us throughout the pandemic. And to talk a little bit more, let's bring in Juliane Morian. She is the director for the Rochester Hills Public Library. Juliane, great to have you with us.
Thank you. My pleasure to talk libraries.
I love the library. It is one of my all-time favorite places. When I was growing up in a little town in Tiffin, Ohio, we got a new library and it was so exciting. And every Saturday morning, that was my escape from the world. Do you see that's still happening today?
It is. We serve so many different generations. So as you pointed out, so many people have that connection to the library because it was a place that they came when they were younger. Typically their parents were bringing them. But for many people, it was also an escape if the library was walkable, like ours is for many people in our community. It was a nice respite for kids to go to after school. But again, like I said, we serve so many generations. I think we serve about 5 different generations, and that's not typical of your average business. So we have a variety of touch points for you, whether you're young, old, young at heart, however you want to experience the library, we're here for you.
When we think about the library, it's like these old school images, right? You go in, there are the lines of shelves with the dusty books, but it's changed over the years. You're trying to accommodate changing technology as well.
Oh, yeah, absolutely. Yes, we are so much more than books. I think if you meet any modern day librarian, that is going to be one of the first things that we share with you. We love our legacy of being books and of reading, so we will never abandon that mission. But we are now all about computers. We're about ebooks and e-audio. We are about STEM kits and having things that help with experience-based learning. Our library has a 3D makerspace lab. And 3D equipment that you can print on, and anything from the Cricut printers where you're doing vinyl cuttings to Glowforge where you're doing etching into wood. We are all about tapping into how you want to improve your life and the learning that you want to do. It used to be in the form of books, but we've expanded beyond that container for many years now.
I'm sorry, I got distracted with that word Cricut.
Yes. So if you're a crafter, you are welcome to come to the Rochester Hills Public Library and partake in our makerspace lab. We call it the Eureka Lab, where you can actually come in and cut out your vinyl, whether it's for something that you're going to, adhere to your walls or on, crafty kind of mugs or scrapbooking or whatnot. So we are here for you in a variety of ways.
That is really amazing. So as you've been able to shift what you offer to the public, how have you had to shift throughout the pandemic?
Yeah, it's a great question. So of course, like many people, we did the shelter in place that was instituted for all businesses and all communities, facilities and everyone back in May and June. I made it a priority to try to reopen as quickly as possible once we felt we were safe. So we reopened our doors to the public back in July. There were some things that were a little different. So like many of the places that we visit, face masks are required, 6 feet distance is required. And the one very visible difference is that we did make the decision to remove chairs from all of our workspaces and from our group study rooms. And that's simply because we're in a mode that we call grab and go. So we want people to come in. We want you to be able to use the library, browse our shelves, find out what meets your fancy that day and take that material home. What we can't allow for right now is people staying and lingering in the library. And so that remains true even now about 10 months later in terms of what we can offer to the public, but we are open all of our traditional hours. We are welcoming people back into the library, whether it's computer use or browsing. And if you don't feel comfortable coming to the library, we are fortunate to have the kind of facility that has a drive-through, so people are able to use us in that capacity if they would prefer.
So with that, we're talking with Juliane Morian. She's the director for the Rochester Hills Public Library. And with that, when it comes to being able to access the computers, because we do know there are some people that don't have computer access at home. So it really has become kind of their lifeline. Yes. Are you trying to limit the time that they're using it? How is that working?
It's a great question. So what we tried to do was figure out what is that sweet spot between what are those must-do activities right now, especially those things that are related to in the fallout from COVID. So whether it was in the summer months and somebody perhaps was searching for a new job because they had lost their job, or whether it was in the fall when they were trying to get their COVID test results and they had to report that to their employer or to their school or whatnot. And now what we're seeing is a demand for computer access because they need to get their vaccine appointments. We try to figure out what is that sweet spot that allows them to complete the work that they need to do, but they're not staying, in an excessively long time in the library. For our library, we made the decision that 60 minutes felt like the right amount to offer. Other public libraries might have a different increment. And again, we respect the fact that each public library had to make the determination based on their resources and what's happening in their community at large.
And so what we love is because it really is a sanctuary for so many people. But on top of that, have you seen more and more people that were reluctant to go electronic now being forced to do so? Even just the things like check out a book.
It's a great question. Our senior management team is actually having lots of these discussions right now because we had to accelerate the learning curve of how to do things on your own. You had to figure out how to check out an ebook or even use self-check, whether you were coming in the library. Our team is spending some time now figuring out the fact that we might have changed how our library customers use us. We've created a new kind of library patron. So for some of our customers, it was a new learning experience, but they've taken to it. And our like I said, our drive-through has exploded in terms of popularity and use. So people who might not have been exposed to using the drive-through now are clued in terms of how convenient that is and how readily available it is. And we don't see that going away. And that's fine by us. It's us saying we can step up and be responsive now. If we've created a new kind of library patron, how are we going to then modernize our library to kind of keep that momentum going? What do they love about what happened during the COVID times? What do we pull forward? And then, like you said, once we're allowed to kind of allow for the soft seating and allow for the study tables to come back, how do we tap back into that idea of being that sanctuary and that third place once we're allowed to do so safely? So yes, our patron has changed, but we're going to lean into it and say, we've just hit fast forward on modernizing the library experience, quite honestly.
Juliane Morian with us here on the Megacast. She's the director for the Rochester Hills Public Library. And with that, Juliane, if I can ask too, though, some people don't understand if I'm downloading a book, if it's an electronic version, why is there still a waiting list on some of the popular books?
It's a great question. Yeah, thank you. Thank you for actually allowing me to talk on that, because if we had our druthers here at the public library, we would buy as many copies as was available for people to use simultaneously. Unfortunately, though, the distribution model from electronic publishers does not play nicely with what we want to do in terms of what we remember how a physical book circulates. So the big vendors that allow for libraries to purchase ebooks. So we can't just purchase it through Amazon or from whatever ebook vendor, the average consumer can purchase from. We have a very small and select group that we can purchase from. They unfortunately control the rights of access to those. So we have to pay more than the average consumer for a book. So whereas the average consumer would pay maybe around $10 to $15 for an ebook, for the typical library book, it's around $60 to $80. So not only is our cost higher,
What? I know. You just saw my jaw just dropped on that price, right? You saw it. I was like, what?
We're really good at stretching the taxpayer dollar, though. So I got to be honest, my team is amazing at figuring out that right ratio of what we should be collecting and whatnot. But we are constrained in terms of what the e-publisher will allow us to purchase and then circulate. So many of our copies are a single use only. So if you're borrowing a book that I want to read, I have to wait for you to return it, or else I would have to pay for an additional copy. So we are hoping and we are agitating for change with our publishers, and we could use community members like you to get a little outreach and help them understand that we want our ebooks to function like physical books. And we think that that's the right of all public to have access to ebooks.
This really is fascinating. And, I'm an avid user of the public library, and this is the first time I'm even hearing that side of it. So this is great that we are able to have this conversation so people can be aware of what happens in the process behind that. And also so we can kind of be a voice for you as well.
That's appreciated. It's a wonderful community partnership. We are here as the caretakers of your library. We want to make the best library for you, but it ultimately belongs to you. So we want to empower you with that knowledge as well.
So we know that the library has been changing also even prior to the pandemic, because we are seeing so many more people come to the library to check out movies and audiobooks and music CDs. How has that world been impacted throughout the pandemic?
For most of our traditional formats, that has remained steady. What we have done, though, is leaned into the fact that what we were seeing is this desire for self-directed, independent learning. We saw this with many of our kids that stayed home during quarantine rules, that parents and families had to get creative in terms of how do you supplement the day-to-day activities that were provided by our wonderful educators, but how do we expand and how do we keep it going? So right now, what I think you're going to see a revolution in public libraries is leaning into more experience-based learning. So sometimes libraries describe this as the library of things. We're describing it as innovative items. So we are looking to add things, whether it's microscopes or telescopes or electronic things that help you assess whether or not your home appliances are running in a green and healthy way. We just celebrated Earth Day yesterday. So we are going to be adding materials and objects and equipment that actually help you have a better life in terms of you understanding how your life and your home and everything like that is thriving, and supplement that from experience-based learning.
So how are events going right now, especially with kids? Because I think of like new parents with toddlers, they would introduce them into the library through talk times and this, that, and the other. How are those programs working right now?
Yeah, it's a great question. Again, our team is trying to read where our community is at. And I touched on the fact that for our area in particular, many of our students were learning from home, right? So there was a lot of Zoom interactions for their traditional education. As such, our team has stepped up. We do offer quite a bit of virtual programming in the form of Zooms, but what we've also tried to do is supplement with hands-on, and that's probably been our best received programs in this time frame. So we have a variety of things that we call take and make. So the idea is that you can register for our program, and you might be doing something from a yarn-based craft, or making sun catchers, or just doing a variety of sort of more hands-on programs. We have found those to be among the most popular that we are offering right now. But what's interesting about the Zooms is that our programming, our attendance has actually gone up. So where we were constrained to, limiting a lecture on a historical topic or something of interest to families and youth, to what we could fit in terms of those seats in a room. What we're seeing now is the medium of Zoom is allowing us to extend this well beyond our walls. And our attendance is actually better now when you count those numbers of views and people watching us than we were in terms of capturing people in the seats.
Do you think that's going to continue post-pandemic then? Or maybe a hybrid model?
I think we're going to see a mix of both. And that's what I mean when I say we are very keen to the fact that we have created a different kind of library patron. So we pride ourselves on being incredibly responsive here at Rochester Hills Public Library. What our community can expect is us checking in with actual members of the community, doing focus tests and doing community surveys to find out what kind of programming do they like, what works well on a Zoom, on a virtual platform, and where do they want to see us return to more of that in-person, hands-on activities as well. So I predict it's going to be a hybrid.
That's a wonderful thing about Zoom, because I think if we would have had this conversation prior to the pandemic, so many walls would have been closed. Yeah. But now we become open to this, because for me, I think it's exciting. Like if you bring in authors,
yes,
to be able to speak, like you don't have to fly them in from California. Exactly. You don't have to fly them in from New York. You can put them up on Zoom and we can all listen and learn from it. Yes. Or even if you did bring them in, it's still reaching a larger audience.
Exactly. If I can speak to that. In fact, Rochester has a rich history of offering something called Authors in April. It's where we would bring in a variety of authors that spoke to sort of the younger set, whether it was like the K through 8, age range. And this year we are doing it as well. However, we shifted to May ever so slightly because of some of the pandemic issues. And
that's okay. It's like Groundhog Day. So April is May. We're all good.
Exactly. We're all kind of merging together. But nonetheless, so we will have an opportunity for some of those authors have made the decision to travel on site, and they will be physically here. But the thrust of what they're going to be presenting to our youth will actually be done via Zoom. So again, it's that hybrid model of when it can be safe, when we can hold an activity where it's a meet and greet with the author outside, we're choosing to do that. But the majority of what will be broadcast to the kids is going to be via Zoom. So we're really looking forward to some of those events that are happening in May.
We're talking with Juliane Morian. She's the director for the Rochester Hills Public Library. I know at the beginning of the pandemic, we were all still learning new things about the virus and wiping down our groceries and, trying to disinfect everything. And now the CDC has come out to say, that's not really necessary. But I wonder when we're looking at some of the books or, the movies and things like that that come from the library, how did you all and your team approach that? And where are you today?
Covering your nose. Thanks. That's a great question because we like to reassure people that we are complying by all of the CDC guidelines, the MDHHS guidelines. But to your point, you're correct. Most of these respected industries have not come out saying that we need to be overly cautious about the transmission of the virus on surface. What you're going to see among libraries, though, is that we conducted some internal studies. They were funded largely through the IMLS, which is the Institute for Museum and Library Services, in terms of trying to understand what happens with COVID persisting on surfaces of stuff that's circulated. And most libraries have chosen to implement some sort of self-quarantine. We do not have a mandated quarantine for materials, but most libraries felt like it was just going to engender more trust with our community to have some level of quarantine. So here at my public library, we have brought that down to 24 hours. We were higher at one point, now we've brought it down to 24 hours. But what we often like to point out that is if anyone was concerned about materials having some trace of the virus from person to person, most libraries offer what's called a holds pickup process, where you have about 3 to 5 days to come in and pick up material that you have requested online. So if somebody felt it was necessary for them to have a few more days where that item just sat on a shelf and we let the natural course of science do its job of letting that virus dissipate, you could also put something on hold and let it persist for a little bit longer. And then I think you're more than safe to use materials from the library.
This really has been such a learning process in so many different areas of our lives. And it's great that members of your team and yourself are able to try to recognize some of the concerns within the community, because we're all learning about this together. So one of my favorite things to do is to go to the big book sales. Most public libraries will have the big book sale once or twice a year. Secret. Wait until the last day when everything goes cheap and you get the big, the big paper bag for $5 or $10 and fill it up. Do you anticipate the book sales going to return?
Yes, I do. And I'm so happy you set me up to ask about this, because we actually have appointment slots tomorrow that if somebody were interested, they would be welcome to sign up. So what we've done at Rochester Hills Public Library is we are fortunate enough in our facility that we have a separate space that's dedicated to our used book sale supply. So our friends of the library take ownership of that. They're the ones who intake all of the donated materials from our community members. They make choices on what should go into what's called our quality sale, and that gets sold online. We have actually spots in our lobby where we have what's called lobby carts. And so we put some of our materials down there, which is just based on honor system, so people can browse and make selections there. Or we have this by appointment shopping for our used book sale room. And so our friends of the library have appointments available on Thursday nights and select Saturdays. So I would say just check on our website, sign up for a slot, and you'd be welcome to come and shop to your heart's content.
Well, Juliane, it's been so fun having you on the show. Anything maybe I didn't touch on that you want to add before we say goodbye for the day?
Just that, a modern library is more than books. And you have asked me so many of these wonderful questions. So thank you for having me today. And thank you for just helping me confirm for your community that's watching that if you haven't been back to your library in recent times, almost all of us have reopened for access. And we encourage you to come on back in and try us out.
It really is one of the best things that we have going for us. So it is a huge asset for so many of us in our community. And I'm always surprised people who say, I haven't been to the library since I was a kid and had to write a research paper. I'm like, what? No, you don't understand. It's not the old library.
Yeah. We have definitely modernized. We are a contemporary library that loves our foundation in books, but we are so much more than books. And what I often say is we were the original subscription service. So it's your tax dollars at work. A lot of times they align us with being a free service, but what I like to point out is that we hope to be a very good return on investment for your tax dollars. So you have already paid for us. Come on in and enjoy what your tax dollars are doing.
Well, thank you again for being with us. We so appreciate your time and also all the work that you and your team are doing over there at the Rochester Hills Public Library. You are listening to 89.3 WBLD, 88.1 WBFH. We're going to take a quick break here on the Megacast. And when we come back, we'll be joined by the communications director for the Michigan High School Athletic Association. So much to talk about with them. That's next here on the Megacast.
Right now, our country feels divided, but there's a place where people are coming together.
I was nervous to talk to someone so different than me.
Me too. Love Has No Labels and One Small Step are helping people with different political views, beliefs, and experiences connect through conversation, and it feels good.
This conversation gives me hope.
It gives me a lot of hope, too. Take a step toward bringing our country and your community together. Start a conversation at lovehasnolabels.com/onesmallstep. A message from StoryCorps, Love Has No Labels, and the Ad Council.
You're listening to the Oakland County Megacast on 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. Back in a moment after this quick break.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Welcome back to the Megacast. As a reminder, Tyler and I are always here Monday through Friday, 10 a.m. until noon. You can catch us on Civic Center TV, Birmingham Municipal Public Access, as well as Channel 15 if you have Comcast, 99 on AT&T. If you're out driving around in the car, you do not have to miss the interviews. Just tune us into the radio, 89.3 Lakes FM, 88.1 FM The BIP. And then today we are also live streaming today's edition of the Megacast on our Facebook pages as well. But on top of that, if you do miss an interview or you want to catch up on previous episodes of the Megacast, you can do so just by going to civiccentertv.com. We post the previous episodes of the Megacast going all the way back to the beginning when it started over a year ago, or if you click on the on-demand section, you can just listen to the individual interviews as well. With that, boy, this year, there have been so many ups and downs throughout the COVID-19 crisis and this pandemic, especially in the world of high school sports. To talk a little bit more, let's bring in Geoff Kimmerly. He's the communications director for the Michigan High School Athletic Association. Geoff, have you been able to take a breath yet?
Finally, after about a year, actually about 13 months, I would say that we are breathing around here slightly easier. Obviously, we're not completely done with things yet, but the last 2 weeks especially have been comparably very quiet around here when you think of everything else we've discussed going back to last March.
Oh, right. It's been such a roller coaster. And if I can just ask you, when the governor recently was kind of requesting everyone take a pause because of the rise of the COVID-19 cases here in the state of Michigan, what was the discussion there at the MHSAA about procedures that should be taken?
Sure. Well, we were down to our second to last day of winter tournaments. We were at the Breslin Center. We had girls basketball finals actually happening that day as the recommendation was coming out, and boys the next day. So we were down to 16 teams left still playing for all of our winter sports. And we knew that we would finish those up, obviously. We had limited crowds. We had incredible safety precautions that were being enforced by the Breslin Center staff, and we felt very safe doing those things. We also had spring sports underway, and we said that local schools would make their own decisions on that. Per the Michigan Health Department, Health and Human Services Department, we already were testing all of our spring athletes and all of our winter athletes that were still in participation. So we were looking out for safety that way. And really, when it comes to regular season scheduling, that is always something that's done at the local level. Our next MHSAA tournament events aren't until mid-May. And so it really is a local decision. We have a huge state, and all of these localities are facing differing circumstances. And it's really those people on the ground in those areas who should be making those decisions. And we of course, left that up to them.
So with that, Geoff, if I can ask you for a second too, when you touched on testing, we've talked with numerous people in the sporting world. It's been confusing as to one thing, they mandate something, but to get it implemented as well.
Sure. I think our schools have probably had a better time with this, especially now that we're into the spring, because so many of them were involved with the pilot program that MDHHS conducted with football and volleyball and swimming and diving when those sports were allowed to return at the end of December to finish their postseasons. And then all of our wrestlers tested throughout the winter as well. So the great majority of our schools have had some experience with this testing requirement. The good news is our schools, we're showing perhaps the most discomfort with the reporting process because they report the results directly to MDHHS. And MDHHS came up with a system that actually made that much more feasible. Took a lot of the time commitment out of that. And so that's been good news. Honestly, people really aren't talking about it that much. I think more people are talking about it outside of sports than within sports. I think people have realized that this is part of what we're doing this spring, and schools have figured out how to do it, and we're just getting it done. We're playing, and thousands of teams are playing every week. And that's good news because we didn't play at all last spring.
Geoff Kimmerly with us on the Oakland County Megacast. He is the communications director for the Michigan High School Athletic Association. And with that being the case, Geoff, now that we're well into the spring sports season, even with the governor's requested pause 2 weeks ago, as you've said, things have been relatively quiet. We haven't heard a lot about any issues with high school sports in particular or getting these protocols in place. So let's start with one. What are the protocols that are currently in place for spring sports, given that a lot of them are outside and many, such as softball and baseball and track, are already relatively distanced?
Well, and that's really kind of, I guess, one of the things that we've all looked forward to is knowing that once we reach spring, all of our sports are outdoors. Anybody that you talk to in the medical field will tell you that the risks go down once you're outdoors, and we already felt like our risks were pretty low because of all the precautions that we were taking, so that's good news. The only contact sports we have during the spring are lacrosse and soccer. We have girls and boys lacrosse and girls soccer, and so they have a few more precautions. They are playing masked, but otherwise, everybody else is, as you said, fairly distanced from one another. We have pages of precautions for every one of our spring sports that we reference on our website, touching on everything from what's due when an infection is found to masking and what is necessary and when it's necessary, to keeping equipment clean, to spectators. The list goes on and on. It really is a pretty impressive body of work. So we have certainly put a ton of recommendations out there, a ton of other things that are mandated. They're all based on what we've received in part from the National Federation, their Sports Medicine Advisory Committee. Our Sports Medicine Advisory Committee has vetted it as well. And we have said all along, we believe our high school athletes and our middle school athletes are able to participate safely. And especially in the spring, being outside with almost all of our sports non-contact, we really feel strongly about that.
Secondly, teams in spring sports tend to be a lot smaller than they are, other than maybe track and field, than you would see in a fall sports season with a sport like football. So with that being the case, in terms of rules and regulations in place for practices, are they still pretty similar to what they've been in past seasons? Have they been relaxed a little bit? What's the status with that, Geoff?
They really are the same. I think we know by this point what our best practices are, and they haven't really changed going back to the fall. A lot of these precautions are certainly on the conservative side. We want people to do everything extra possible to be as safe as possible. You're right. Most of the teams are smaller, but track teams are still pretty large. We still have about 100,000 high school athletes during our spring sports. And I think everyone realizes that whatever the precautions are, they're worth taking. No one's going to forget anytime soon that we missed a season. And that's been something that's driven us in this office the entire school year. And it's been one of the wonderful things, both at the end of winter, just hearing from so many athletes and families and schools about getting to finish, and now seeing and hearing the same things this spring about just getting a chance to participate again. It really has put things in a much fuller perspective when it comes to athletics as a whole.
Geoff Kimmerly joining us on the Oakland County Megacast. He is the communications director for the Michigan High School Athletics Association. And Geoff, earlier on, and really throughout this pandemic, we've seen a lot of ups and downs with case numbers, with the situation here in the state of Michigan and in neighboring states, and that's had an impact in the past on the length of these sports seasons, of obviously a lot of start and stop, particularly in the fall and in the winter. How is that translating to the spring? How are those previous stops and those previous issues impacting the spring season? Are we in a shorter season? Is there going to be a different playoff format? What's the status with all of that?
We did start practice a week later. Competition started, I don't believe it was a full week later, but it was a few days later, obviously, because we wanted to give teams time to practice before they competed. But at the same time, we're really planning on being on our regular schedule. We have not changed any of our dates for our postseason competition, including our finals. Those are still scheduled to finish over the first 3 weekends in June. And, that's really something that families have voiced a lot of desire for, and schools obviously echoing those families. People want to be able to play, but they also don't want to be playing deep into the summer. And we don't feel like that's necessary this year. We feel like the few days that we missed early on are more than made up, especially when you consider weather. And that's why this 2-week pause, we certainly have had some schools that have taken the last 2 weeks off. But in the long run, I don't think it's going to be a huge thing. If you really look at Northern Lower Peninsula and the Upper Peninsula, they don't get to do a ton outdoors until the end of April and the beginning of May anyway. So for the most part, I don't see a whole lot being affected. Spring is used to condensing quite a bit into a short amount of time and moving pretty quickly. And I'm sure this will be just like any other spring that way.
There's a lot of variation, Geoff, with who can and cannot get vaccinated at this point in time. That may change. There's been some proposals from these companies that have produced currently on the market vaccines to lower the minimal age for receiving these vaccines. With that being the case, and as we're looking forward to maybe the fall season, not knowing if or when we're going to be out of the bulk of this pandemic, is the MHSAA currently considering any requirements for vaccinations, or leaving that potentially to local districts to make that decision?
That's not something we've discussed. Obviously, school personnel have been eligible for vaccinations for a little bit longer than people in other professions, and so we anticipate that a lot of school staff have been vaccinated. We know just anecdotally that students are getting vaccinated. I think it's 16 and older now are able to do so with at least one of the vaccines. So we have not proposed anything like that, but we do anticipate, just as listening to the governor and listening to the health department and everybody else, that we're getting to a point where these things are going to start taking effect, and hopefully continuing to bring these numbers down, and hopefully this won't even be something that we'll have to really talk about a lot when we get to the fall. We hope to be in a much better place than we've been over over the last year.
This is the last spring season. The spring season is the last sports season for high school athletics of the year. Of course, we're speaking with Communications Director Geoff Kimmerly of the Michigan High School Athletic Association. So looking forward to fall, with this summer being kind of a reset where there's not that overlay from one season to the next, and whatever delays have happened in 2020 and into 2021 don't necessarily affect the fall. What is the MHSAA doing at this point to plan for whatever situation with COVID in mind might be in place in the fall? Of course, there could be normal operations if we're out of the pandemic by then, but we could still potentially have more setbacks, as we've experienced time and time again, that could lead to some hiccups or some changes. How is the MHSAA consulting with these local districts, of course, planning for the fall sports season?
Well, of course, one of the lessons of this entire pandemic, from not only our point of view, I'm assuming most points of view from different groups, different associations who operate within the public, is the necessity of being flexible and being nimble. Yeah, we would like to look at the fall and think that everything's going to be back to normal and we'll be able to do the things we've always done. And I think right now, from a planning standpoint, that is what schools are doing in terms of scheduling and things like that. At the same time, although seasons end at the middle of June, off-season training does not, and schools will still have students in and out of their buildings, outside, things like that. So they'll be continuing to put all of these safety precautions into place that we've had all year long, and continuing to work with whatever changes come along the way, whether things hopefully continue to improve. If the health department comes out with different recommendations, if the CDC comes out with different requirements, things like that. So yeah, right now we'd love to all say we're looking at doing things as normally as possible, getting back into August. And if something changes between then, we'll adjust to it. We've certainly shown that we can do that, especially over the last 6 months.
Yeah, it's definitely been something that the MHSAA and these local districts have proven to be very proficient at doing, is making these quick adjustments, continuing the season as safely as they possibly can, and allowing these high school athletes to have this vital experience to their development as they go through their high school career. Geoff Kimmerly with us on the Oakland County Megacast. He is the Communications Director for the Michigan High School Athletics Association. And Geoff, we've seen in a lot of different industries over the course of this pandemic, especially lately, there's been a lot of calls for needing help in staffing. The MHSAA is always looking for new people to join the ranks, particularly on the field as referees, to help facilitate these games. Is that push still continuing, and is the MHSAA having any issue right now getting new people to referee these games, or people that have been refereeing maybe being a little apprehensive due to the continuation of this pandemic?
Yeah, absolutely. We're always, of course, recruiting officials. We're always hoping to bring in, new officials, young or old. Obviously, young would be great because we have a chance to have them in our ranks for a number of years to come. But we'll take, we have a lot of people who retire and decide to become officials as well, and they're awesome to have as part of this also. The thing that we work through the most when it comes to officiating is probably retaining officials. We do a pretty good job of getting interested people to give it a try, but it's a matter of keeping those officials past that first year, past those growing pains, the first times having to work with parents yelling at you and coaches, working with you on things and things like that. It's a matter of getting officials through those first couple of years, and then they tend to stick with us for quite a bit. So retaining officials is a big deal for us. Our numbers certainly were affected by some people being cautious because of COVID-19, which is totally understandable. We were able to make it through our tournaments with enough officials to handle all of our games. There were some regular season games here and there that had to be moved and adjusted and postponed, and I'm sure there were probably a few cancellations because certain areas had shortages. But at the same time, when we got to the tournament portions of our season, really the most important games, even at the end of the regular season, we were able to fill all of those games. And so just like we give a just an absolute ton of credit to our athletic directors that are out there in all of these communities making this work and doing an incredible amount of work to provide these opportunities. The same credit needs to go to our officials that who are working many nights a week. Already in past non-COVID years would be handling tons of games. Now it's probably even more so. And so we just have our appreciation for that group of contributors is always extremely high. And if it's possible for it to be even higher, then we're probably there right now.
Geoff Kimmerly with us on the Oakland County Megacast, Communications Director for the Michigan High School Athletic Association. Geoff, just another 30 seconds or so with you. Anything else that would be important for our audience to know from the MHSAA, or anything else that you'd like to say today before we let you go?
You know, the one thing that we have wanted to do this school year was to have 3 seasons and have them finish with the normal expected championship conclusion. And the fall, we definitely had to maneuver a little bit, but we got that done. The winter, same sort of thing, especially at the beginning, but we were able to get that done. The spring really should be our smoothest road in terms of reaching a conclusion. And so we're just really thankful, again, to those athletic directors, other school administrators, coaches, officials, families, parents who have been incredibly supportive and understanding the things that we need to do to make this work. People realize, I think at this point, what has gone into giving this a go. And we're almost at the finish line. And then, of course, we start over again. But certainly this has been an unprecedented year, at least in our lifetimes. And we are just really thankful to many people who obviously are not ever going to receive the credit or be mentioned as part of making this happen, but have had as big a roles in doing so as anyone.
Geoff, we thank you for being with us today.
Thanks for having me.
Geoff Kimmerly with us, the Communications Director from the Michigan High School Athletic Association. We're going to take a quick break here on the Megacast. Still a lot to get to in the last 40 minutes of the show. Coming up next, we'll speak to author Lisa Rose. She's got a new book coming out, and we're going to talk to her about that and so much more. This is the Oakland County Megacast.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands.
Watch your distance. And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Welcome back to the Megacast. I'm Ronnie Dahl here in my home studios. Mr. Tyler Keefe holding things down back there in West Bloomfield. Tyler, I always just throw the sports interviews over to you. Like, I can ask a few generic questions, but you are such a sports fanatic.
Yeah, I have fun taking those over, too. It's fun to have a conversation, even at the high school level where things are pretty cut and dry usually, other than talking about specifics of games. But there's a lot that's been going on with the MHSAA, and they've had to do a lot of extra work. They've had 3-4 seasons worth of labor that have gone into just these 3 sports seasons so far this year. And hopefully next fall they can get back to something a little more normal and relax a little bit.
They've had a tough year trying to manage all of this, but I've said it once, I'll say it 1,000,000 times. Tyler, you need a sports show.
Oh, please.
Hey, switching topics just a little bit. So many of us right now, you're stuck in your home. What are you doing? Instead of binging on movies and YouTube, why not pick up a book and read to your kids? Get them engaged. To talk a little bit more, let's bring in Elisa Rose. She's an author for The Singer and the Scientist. Elisa, you look a little different than the last time you were on the show.
Yes, I was a zombie last time with a zombie vacation. So I got to be myself, which, may be good or bad, depending.
But it's so fun. You're so fun and you're so creative, and you do it as a way to try to reach kids.
Thank you. Thank you.
So tell us, you have a new book already. Tell us about this one and the inspiration for it.
Well, this one, and just so you know that the book wasn't just done, books are sold like 2 years in advance, and it just so happened that they came out. I got the pleasure of launching 2 books during a pandemic. So that extra challenge. But this one, in my other life, I'm a teacher, and I've taught mostly in Pontiac and Highland Park. And most of my students have been African American. And I am Jewish, and I always thought that there are so many similarities between our communities. And historically, our 2 communities have worked together and united for civil rights for all people. And so I was really attracted to this story, which is about Marian Anderson, who is a very famous singer who came to sing at Princeton University. And that is where Albert Einstein was teaching, and he loved music. And in fact, he was deciding to go into music or to science. And he obviously chose science, but he still loved music. So he was there. And at the end of the evening, Marian Anderson, who was Black, asked for a room at the nearby hotel. And she was denied. And Albert Einstein heard this and said, "Please come and stay with me." And that evening was the start of a beautiful friendship that lasted until he passed away.
Is that based on a true story?
That is a true story.
Wow.
So nonfiction, everything is true. And in fact, Marian Anderson's autobiography actually told it a different way. And that is because she really liked to downplay conflict. And at that time that she wrote the autobiography, it was before the Civil Rights era. And so this book was actually going to be published years before. And the publisher got a little timid and decided not to publish it. And then just for the sake of myself, and all of my years of watching Law and Order, I put that to good use. And I got Albert Einstein's story certified with her estate. So that was really the true story. So really, I really had, for nonfiction, I really had alternative facts. And I had to prove which fact was true, which was actually true. And I think that's really important, that for kids that you know that this is a picture book and everything is validated and true. And in fact, even the illustrations, I had to proof the illustrations in Albert Einstein's, the door of his house was on the wrong side. So my illustrator actually had to change the way that the house looked. So that's really important that children's authors do a ton of research. It is a lot easier being a zombie and making up. But there's so much research that goes into 500 words and 32 pages.
Right. Lisa Rose with us here on the MegaCast. She's the author of The Singer and the Scientist. But how important was it for you to take such a story with so much richness and so important to really tell, even more so, I think, today in our world today, and put it through the eyes of a kid? How were you able to do that?
Practice. Lots of practice. And that's what, I think I want to say it was Mark Twain who said that I didn't have time to write you a short letter, so I wrote you a long letter. And that is really the trick of a children's author. It's how to pick just the right words. Every word has a certain weight and a certain value to it. And hopefully I get all the right words in all the right order.
So as you mentioned, you're launching 2 books in the middle of a pandemic. Challenging.
And you know what? It's actually, I've looked at the bright side in the sense that, I used to have to turn down events because they were on the same day and logistically I just couldn't get from one place to another. But now I can be in New Jersey one minute and California the next. So for authors, yes, I miss the in-person, but it has been really nice that I can give my presentation all over the country and the world. So I've really enjoyed that aspect, but I'm ready to be done, like most people.
Right? That is so true. And we do anticipate there's going to be a portion of this that will stay with us after, the pandemic, because like you said, in some ways it is easier as well. So maybe you can double book.
You can do that. And also it's more affordable. That is actually really important for schools and organizations to know that, it takes a lot of work to bring in an author. You have to pay for the transportation and everything else. And if it's around the country, it could be very expensive, but it's very affordable to bring in an author for a video virtual visit. And so I think in that aspect, as authors and talk amongst ourselves, like how we are going to go forward, that is something that we are going to definitely continue. So I see that aspect is still with us for my profession.
So your books tend to have a social component to them. How important is it for you as an author to tell these stories and to start that conversation with kids at a young age?
I think it's really important. I think it's also a handicap of mine because, I am a teacher. So I want it to have an educational component and to have kids grow from it. And, The Singer and the Scientist on my website has a wonderful teacher's guide that really helps start the conversation. And these are conversations that, you begin at a very early age and you'll continue to add to it because, unfortunately, racism and anti-Semitism is not a new topic. And it's not going to go away overnight. So I think this is something that you have to continue to talk about it so that it can dissipate.
Who do you feel like gets the bigger education out of your books, the parents or the kids?
I think, picture books, I always say, are for everyone. A lot of people think that, they're old enough, they don't have to read picture books anymore, they have to read chapter books. But I think they're for everyone, and I think you can get different things out of the picture book if it is well written at every age. I mean, there's picture books that I look at and I am inspired and I see different things now that I have more experience as a writer.
We're talking with Lisa Rose. She's the author of The Singer and The Scientist. As you were saying, what has been the response from the community on this book?
Well, everyone, I guess it's kind of a plus or minus. I've had a really good timing, accidental good timing with everything that has happened in our country recently. So they think that it is poignant, age appropriate, and something that will be important to share with kids, and that was really my goal, and so I'm happy with that response, and just like this book is really very, very different than most of my other books. We talked about earlier I was a zombie, and most of my other things are very humorous and silly and light and funny, where this is kind of, I get to kind of show my serious teaching side. In fact, I had an editor who was like, my Lisa wrote that? So I'm glad to also show my depth as a writer.
How do you come up with the topics for your books?
Well, I think that things sometimes just pick you. You go through life and you are inspired by different things. And you never know when it's going to hit. But there's, being a writer, I have my books behind me, but I have hundreds of other books that are never published. And I think that's important to know that you're always writing, but you're not always publishing.
That's a good point, because some people will see like just the books and they think, oh, it's quick and it's easy. But there's a lot of trial and error in this.
Right. And especially with this book, there was a whole backstory. It was almost published years before, and it didn't happen. So I think, there's always the book, and then there's always the story of how the book was born. And writers don't write one book and then stop. They're always working on different things, and always in various stages of books. And that's what I always tell kids, is that writers keep writing. And they write because it's inside of them, not because they're going to get that end publishing, or become $1 million, $1 zillion rich like J.K. Rowling.
Yeah, and they say the only good writing is the rewriting.
That is true. There's a lot. And I always, show my students that even though the publisher has agreed to publish my book, they love seeing the fact that my editor has marked up my writing with all the stuff. And I was like, look, I have the critique too. So I think it's really important that kids know with anything, it takes practice.
It takes work. So you're still teaching, right, Lisa?
Yes, I am still teaching. I'm actually a writing coach at Waterford Montessori Academy. So I'm enjoying, I get to teach K through 6, So I'm enjoying going through the writing process with the really young ones and the really old ones.
So not to put any pressure on you, because we do know you released 2 books throughout the pandemic. What's next? Do you have another one on the horizon? Why not make 3? Go for a triple.
I have some things in the works, but I have nothing that I can publicly announce. But really what I'm trying to do now is write beginning chapter books. So for the kids who are just beginning to read, and I taught first grade for many years. I say I'm a recovering first grade teacher. So, I'm really writing for those kids who are just starting their independent journey with reading. So I'm hoping to have some news, but we will see. And I think that's important to know that I had a time where I published, and then I had nothing, and then I had a year where I had all these things accepted and out, and so now you have to have a little dry spell, and then and then hopefully have some more good news soon.
No, that's just called rebuilding your reservoir of creativity. That's right. Lisa Rose with us here on the Megacast. She's the author of The Singer and the Scientist, her second children's book that is being released throughout the pandemic, also a local teacher. And with that, Lisa, where can people find the book?
The people can find the book everywhere. It's at Amazon, Barnes and Nobles. It's they can go right to my website, Lisa Rose Writes, like writes a book, WRITES.com. It will have direct links to where you can buy it.
It really is a great story and such an important teaching moment for so many of our children. So, Lisa, we always appreciate your time here on the Megacast.
Thank you so much for having me.
We're going to take a quick break here on the show. When we come back, just about 20 minutes left here in the show. And when we come back, we're going to have the Capital Improvement Planning Director for the Great Lakes Water Authority. That's just one title that she has. An amazing life story. We're going to be talking with her right after the break on the Megacast.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or 2 or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Welcome back to the Megacast. I'm Ronnie Dahl here in my home studios. Mr. Tyler Keefe holding things down back there in West Bloomfield. Just as a quick reminder, if you missed any portion of today's Megacast or previous episodes, you can always find them civiccentertv.com. Click on Megacast, or if you just want to watch an individual interview, you can do so by clicking on the on-demand section. Just about 15 minutes left here in the Friday edition of the show. And with that, I just want to go ahead and jump in to the interview with our last guest, because you do so many things I'm like, how many hats can one person wear? Let's bring in Dr. Dima El-Gamal. You're the Capital Improvement Planning Director for the Great Lakes Water Authority, but you do so many other things on top of your professional life. Before we jump into some of your other advocacy work, can we talk a little bit about your position, but also being a female in the world of engineering?
Good morning. Good morning, Ronnie. Thank you for having me. Yeah, engineering is a little bit of a challenging world for a female. It is. I just joined actually GLWA, Great Lakes Water Authority, recently on April 19. A very exciting position as a Capital Improvement Planning Director. Before that, I was a principal for a consulting firm for 23 years. Out of Ann Arbor, and it is a very exciting field for females. It's a male-dominated field, as you just mentioned, but it is a really interesting and really fun profession. We have the brains for it, I tell you. I was working as a principal for a while, and my line of work was civil engineering. So I work on master planning, on funding, design, construction, and my line of work was majorly with municipalities. So I work with townships, with cities, and majorly on water and wastewater infrastructure. So basically, all the hidden infrastructure was my specialty. We work on getting water to all our residents and taking the water away from them. So it's a really interesting line of work, and we take pride in making sure that there is no service interruption or there is no flooding in people's residents.
As someone who has covered so many water issues throughout Metro Detroit, from the constant flooding in some of our neighborhoods to the Flint water crisis, but then also, I was very fortunate to go to Kenya and do a story about some of the work that is being done there. And you have such an appreciation for water, and I think it's really come to the forefront here for all of us with the Flint water crisis. So your position with the Great Lakes Water Authority, what do you hope to do there?
So being the Capital Improvement Director, I will be responsible for the 10-year asset, work that we will be responsible for as far as capital improvement projects. Great Lakes Water Authority has $1 billion worth of capital improvement projects for within the next 5 years on water side and wastewater sides. We have 5 water treatment plants, 1 huge wastewater treatment plants, and a tremendous infrastructure. We serve 3.9 million people. So the intention is to make sure that whether it's a new project that is needed or it's an operation or maintenance project that is needed, that we are on top of it. And we are making sure that there is no service interruption for our partner communities. And partner communities are all the, West Bloomfields of the world, are the Bloomfields, the Waynes, the Detroits, and you call it, it's a huge spread of communities and municipal services.
I love that you are heading up this project. Do you feel like you're an inspiration, a role model for other young women looking to go into engineering?
There is a lot of inspirational females in the field, and I take pride that I am one of them. You gotta love what you do, and you gotta do what you love. So. This is something that is very important, and I think women are going to be the next leaders in the field, and there's a lot of push toward that, and I'm hoping that as we grow in the profession, you're going to see a lot of leadership up in the STEM field in general, not only engineering.
And it's the old saying, if I see it, I can be it. And you are really a model of that. Dr. Dima El-Gamal with us here on the MegaCast. She's the Capital Improvement Planning Director for the Great Lakes Water Authority. But outside even your professional life, you are also an advocate for Muslims and Arab Americans here in the United States. Do you want to talk a little bit about your other work?
So I wear a lot of scarves. I don't call them hats. So
I love that, by the way. That's a great way to put it.
And I take pride in community service because we got to give back. You know, we take a lot from what the American dream gives us, and we are part of the fabric of the society as Muslims and as American citizens. So I am appointed to the Planning Commission at West Bloomfield Township, and I take pride at giving back to the township through that position. And I'm also, through the Muslim community, I take pride in being part of the interfaith committee at the Muslim Unity Center of Bloomfield Hills on Square Lake. I hope everyone knows that, and if you don't, please get familiar with that. And I'm also part of their civic engagement committee, which educates the community about their civic engagement duties and their civic engagement rights. Under the interfaith committee, we try to build bridges with the community and with our neighbors and friends, because you gotta understand and you gotta have knowledge about your neighbors to be able to be friends and to be able to you gotta know who your peers are. You got to know who your friends in school are to be able to build bridges with them. And we have great relationships with schools. We have great relationships with other institutions, religious institutions, and that makes a huge difference. Other hats I wear is through Wayne State University. I'm on their advisory board because that's where I graduated from. And I'm also, I have a great passion for inclusion and diversity. So I am on Wayne State's Inclusion and Diversity Committee as well. There's a lot of other scarves as well, but I don't think you have enough time for them.
I am going to say, you must have a lot of extra time in the day. I'm like, how do you manage all of this?
Well, I go by the saying, volunteers don't necessarily have the time, but they do have the heart. That's an Elizabeth Andrew quote. Don't ask me where I find the time. It just comes out.
And on top of it, you're a mother.
I'm a mother of two, and my two kids are now, one of them is 22, I'm 21. And my daughter is she's 19. So I take pride in one of them going to Wayne State just like I did. And the other one is a U of M, Go Blue. He's graduating next week. So life is good.
My niece is graduating next week at U of M as well. So maybe I'll see you at the ceremony, but it's virtual for the parents, so we won't. But
wonderful. Congratulations. Dr.
Dima El-Gamal with us here on the MegaCast. She is the Capital Improvement Planning Director for the Great Lakes Water Authority. Can I ask you, how has the past year been for you? On so many different levels. You switch jobs, you're doing your advocacy work, but you're also a mother at the same time. How are you doing?
So past year had, I can say it has gone with mixed emotions. It was a little bit tough and challenging. The pandemic has not been easy, but at the same time, I did see the light at the end of the tunnel, or I did see the silver lining from the pandemic, because it did bring us closer as a family. It did get us to a different level of connection, with teenagers and almost adults now within the family. We did not have the connection that we had before. I had a senior who graduated without a graduation, real graduation party. She did not have the entire graduation ceremonies that a senior would go through. But at the same time, we grew up resilient as a family. as Muslims, we went through, this is our second Ramadan. And by the way, Ramadan Mubarak, blessed Ramadan to all, to everyone who is hearing, who is of the Muslim faith tradition. We did not connect with our faith institutions the same way that we connect every year. We did not have our prayers in our, in our mosques. And we replaced the in-person rituals with the screen rituals. These were tough times. These were challenging times. And I'm not going to say they were depressing, but they were a little bit tough on a lot of people. But at the same time, they did get us more closer. We did invent ways to connect. FaceTime was a lifesaver. But
I didn't even know what Zoom was before all of this.
Oh my goodness. Even through work, I can tell you since March 10 of last year, my entire work life was through Zoom, through Teams, through Google Meets, and we still survived. We still did work, and we still made money, and we still met our bottom line. So I think where there is a will, there is a way, and people will survive. But I really hope that we get back to the in-person life again, and people stay safe, and people stay, survive this and come out resilient, and know how to deal with these challenges and value what we had before.
So with that, Dr. Dima, can I ask you, do you think because of the pandemic, we've all come to appreciate Mother Nature so much more throughout this pandemic? Do you think in the long run, this could really help raise awareness about some of the work that you and members of your team are doing?
I definitely think that everyone is going to have a lot of appreciation for everything that surrounds them. The smallest thing, I look back on the smallest communication that we used to have in person. The first responders, a lot of things that people used to do and you take for granted. Now we should have a lot of appreciation to that. And I think even people will have more appreciation to the people that are working outside and making sure that our life continue to function. And hopefully there will be more compassion as well for others. And I think things will get back to normal, hopefully within time, but we just need to stick together and continue to have the compassion.
Well, one thing we've all learned that we're not separate. We are all connected. And if anything, the pandemic is a constant reminder of that. My breath impacts your breath. It doesn't matter our background. So hopefully it opens up our hearts to people of different backgrounds and different worlds and religions. But with that, can I ask just about another minute or two here with you? What advice would you give to other young women that feel like the world of engineering or STEM, those jobs which are so male dominated, are off limits to them?
So my advice to them is don't get intimidated. The sky is the limit. Someone like me who has been working for 23 years for the same employer, I changed because of you. I read Powering Up by Ann Doyle, and I was swimming. I was the frog that was swimming in luke water and very comfortable, but I changed to give you the idea that you gotta be a leader and you gotta move on and make sure that leadership is open and you gotta break the glass ceiling. So there's always a seat for you on the table, and you gotta make sure that the opportunities are there and you can make it, because a lot of us are there and we are opening that door for you. And we're here so we can support you. Find a mentor, find a champion. My mentors opened the door for me. I appreciate them. And you too will find someone who will guide you in the future.
How do you get so passionate about this arena?
I love it. I love what I do. When you do your projects and when you finish the project, you look back, you see the satisfaction, you see your clients appreciate you, you see what you finish. That's the ultimate satisfaction, is what you do and what you finish. And again, if you love what you do and you do what you love, you will have the satisfaction.
Dr. Dima El-Gamal with us here on the MegaCast. She's the Capital Improvement Planning Director for the Great Lakes Water Authority. Just a few seconds left. Anything maybe I didn't ask that you want to add before we say goodbye for the day?
I just want to thank you for having me today. And, like I said, Ramadan Mubarak to everyone who is celebrating. And thank you for everything you guys are doing. Appreciate it.
Well, and by the way, what's your son studying?
My son is trying to take his MCAT. He just finished U of M biochemistry.
Oh, he might be in some of my niece's classes. We should talk afterwards. So wonderful. Tell him the best of luck.
Thank you. Appreciate it. Have a great day.
You too. We're so lucky to have you as a leader here in our community, not just in the world of engineering, the work that you're doing on that side, but also your advocacy work for Muslims and Arab Americans here in the Metro Detroit area. I live right around the corner from the Unity Center, so maybe I'll have to stop over one day.
Wonderful. We look forward to having you. Thank you, Ronnie. Have a great day.
Thank you again, and happy weekend to you and to your family as well. And congratulations again to your son. I'm sure it's been a long journey for him. So
it is, and it went by so swiftly. I don't know how life is going, but it's been a great journey at U of M.
They grow up quick. That is really going to wrap it up for the Friday edition of the MegaCast. We want to say thank you to everyone for tuning in. Larry and Jake behind the scenes, again, always appreciate the work that you do to get us on the air each and every day, as well as Tyler. Thank you, everyone. Have a great weekend.